Hello, my name is Robert Flowers, and I am a clinical therapist and trained ketamine integration therapist here at Ignite Counseling, Colorado. Today, NC and I will be chatting about what to expect when starting the ketamine integration therapy and some commonly asked questions folks may have.
Hi, everybody. My name is NC Hardy. And just like Robert, I'm a clinical therapist and trained ketamine integration therapist here at Ignite. We are actually just two of several KIT trained therapists.
Excellent. Well, NC, I do have the first question to go out to you here is what is ketamine integration therapy and how is it different from just doing the ketamine medicine itself?
This is an important question. Ketamine integration therapy takes place the day after the medicine session, so in the window of 24 to 48 hours after you experience the medicine. What makes this really important is that your work with your therapist is going to help you to identify themes, insights, perspectives, and the most important part of really maximizing the neural flexibility and plasticity provided by the medicine. So your therapist is going to help you navigate all of that plus any challenging material that may come up. And in doing so, help you to envision potential changes in your thinking or your behavior. And then the last important thing about doing ketamine integration therapy is that you have a multidisciplinary team to work with. So you've got your medicine side, they're doing the dosage, they're doing the medical aspect of it, and then you have your therapy side, which is the Ignite team. These two components make up the whole multidisciplinary effort. So, Robert, do people go to Ignite for the medicine?
That's a great question, NC, and one that we get quite a bit. Here at Ignite Counseling, we're not medicine providers, and we do not provide the ketamine or esketamine, commonly known as Spravato, on site. However, we aim to work collaboratively with an individual's provider to ensure a coordination of care between the medication provider and our team here at Ignite. What we try to do is collect what's called a release of information, just to allow us to coordinate care with the provider, to introduce ourselves, and to get maybe a little bit of a rundown of what that treatment plan might look like. We find that that's the most effective way to really coordinate that care is us being able to contact that provider. So if an individual is interested in learning more about those community partners, they can reach our client care specialist at our main phone number. So, NC, I want to start ketamine treatment. What do I do next?
The first thing that you'll do is you'll find the medicine provider. So you'll find someone that accepts your insurance, you'll check to see what your financial responsibility will be, and then you'll schedule an intake with them. So that intake is going to include a medical screening to determine your medical eligibility.
Okay.
You'll establish care at Ignite if you are not already established. So you'll set up care with one of our ketamine integration therapists and you'll say, I am starting this medicine. I've already done my medical screening. You'll sign some documents called ROI so we can talk with your other provider. Then you'll work to coordinate your scheduling. So you're hitting that 24 to 48 hour window after your medicine.
All right.
So then, Robert, what does preparing for the medicine look like?
Absolutely. So you started to talk a little bit about this in your last question about the medical
Mhm.
assessment. Well, in our team, we also do provide our own assessment as well. We aim to provide a standard of care to ensure your engagement in the integration therapy to be as meaningful and informed as possible. So, what this preparation may look like, it could be having a free 30-minute consultation with one of our trained ketamine integration therapists. Once you and your prospective therapist have agreed to work with each other, you'll be provided intake forms and consents for treatment. If you are already established here at Ignite, there are a few additional forms that we would go over with you, just the consent for ketamine integration therapy, as well as
Mhm.
those releases of information that you reference. And then we would schedule our evaluation session. Your therapist will work collaboratively with you to complete a detailed biopsychosocial assessment to
Mhm.
better understand your general history and the nature of the presenting concerns that you wish to address. You and your therapist will work towards creating a collaborative individual treatment plan outlining your goals and intentions for your involvement in the integration therapy. You will work with your therapist to create what we call set, setting, and intention, which could include resource building, education, and discussing what to expect from your medicine sessions, as well as what you may want to bring to your medicine and integration therapy sessions. But then also, too, creating a safe environment for yourself during that time. So, our hope is to provide some insights into how to make this experience personal and meaningful to you, as well as build that rapport and trust with your provider to assist you in your medicine and integration journey.
It's really good to talk through some of these questions. So I'm glad that we had a chance to do that for people who are considering starting it. If this series of Q&A actually leaves you with more questions, please contact our main line and we'd be happy to help.